signs is a collective term that serves as indicators of the body's physiological status and, of course, responds to physical activity, environmental conditions, and emotional stressors. Originally, we have 4 vital signs. We have blood pressure, heart rate, respiratory rate, and body temperature. Before taking the test, let the patient rest. Prepare the digital thermometer to be used. Clean the tip or bulb of the thermometer using 70% isopropyl alcohol. Press the power button of the digital thermometer. Observe the digital display is clear. Place the digital thermometer on the armpit of the patient and wait until the thermometer alarms. In here, you can talk to your patient. When the digital thermometer alarms, remove it from the patient's armpit and record the body temperature measured on the thermometer display. Clean the digital thermometer again using 70% isopropyl alcohol. After the test, place the clean digital thermometer on its proper container. Do not take the resting heart rate if the patient had undergone any strenuous activities or if the patient consumed any caffeinated drinks or any stimulant drugs. Make sure that the patient is well relaxed, comfortable, and seated properly. Grab the wrist of the patient and place your index and middle finger on the patient's wrist, just below the thumb, and feel the pulse. Check the rate. Measure the pulse beats while simultaneously looking at your analog watch, counting for 30 seconds. Count the number of beats for the 30-second period, then multiply it by 2. In here, my patient is having 80 beats per minute in his left radial artery, palpatory, in sitting position. Now I'm going to record the pulse rate. Make sure that the patient is well relaxed, comfortable, and is seated properly. Count for at least 30 seconds the total number of breaths of the patient and multiply it to 2. This can be done by observing the rise of the patient's chest while you appear to be taking his pulse. Try to do this surreptitiously as possible so that the patient does not consciously alter his breathing rate. I had observed that my patient is having 15 cycles per minute diaphragmatic breathing in sitting position. Now I'm gonna record his respiratory rate. Let the patient properly sit in a comfortable chair and rest for 3 to 5 minutes without talking before taking a measurement. After which, let the patient sit still and place his arm at the same level with the heart on the table. Wrap the cuff around the patient's upper left arm so that the line marked artery or arrow indicator is roughly over the brachial artery, located towards the medial aspect of the antecubital fossa. Be sure that the bottom edge of the cuff is at least 1 inch above the crease of the elbow. Put on the stethoscope so that the earpieces are angled away from your head. Place the diaphragm of the stethoscope over the area of the brachial artery. Make sure that the cuff is roughly at the same height as the heart. The arm should remain somewhat bent and completely relaxed. Turn the air release valve on the inflation bulb clockwise until it no longer moves. This is the position which allows air to enter and remain in the cuff. Hold the diaphragm in place with your hand. Use the other hand to pump the bulb until 150 mmHg on the manometer. Then listen. Now slowly deflate the blood pressure cuff by turning the valve in a counterclockwise direction while listening over the brachial artery and watching the pressure gauge. The first sound heard reflects the systolic blood pressure while the diastolic blood pressure is measured when the sound completely disappears. Now, record the measured blood pressure in mmHg. My patient here is having 110 per 60 mmHg in his left brachial artery auscultatory in his sitting position.